Hi class, this is Mr. Olson. The focus of today's lesson is on alcohol, tobacco, inhalants, cocaine, marijuana, and peer pressure. For this lesson, you will need a pen or a pencil, a blank piece of paper, and your health folder. Please take a moment to get your materials organized by clicking the pause button. Okay, boys and girls, let's get started. When you see the words alcohol, tobacco, and other street drugs, what words come to mind? Please take a moment and write down some ideas on a blank piece of paper. Remember to click the pause button, otherwise, this presentation will keep going. Also, remember to bring these notes to class. Lesson objectives. As a result of listening to this presentation, you will come to understand the following. What is a drug and how are they classified? What is alcohol, tobacco, inhalants, cocaine, and marijuana? What are the short and long-term effects of these drugs on our bodies? And how do I respond to peer pressure when faced with these drugs? These 4 questions will be answered throughout this presentation. Key term drugs. A drug is defined as a substance that changes how the mind or body works. It is important to know that not all drugs are bad. For example, medicines such as Tylenol and Advil are drugs that are used to prevent, treat, or cure a health condition, such as a headache or muscle ache. In contrast, drugs such as alcohol, tobacco, inhalants, cocaine, and marijuana can have a devastating effect on one's health if used and abused. How are drugs classified? Well, that's a great question. First, drugs are classified according to 4 major categories: depressants, hallucinogens, opiates, and stimulants. We will discuss each of these in more detail in the coming slides. How are drugs classified continued? Depressants are drugs that slow normal brain function. Depressants can be highly addictive and can result in life-threatening situations. A prime example is alcohol. Although alcohol is a depressant and can result in cirrhosis of the liver, it is considered legal at the age of 21. The second category is hallucinogens. Hallucinogens are drugs which alter one's perception and feeling. For instance, hallucinogens change how the brain perceives time, real-life situations, and the surrounding environment. Marijuana is an example of a hallucinogen. The third category is opiates. Opiates are powerful painkillers. They produce a quick, intense feeling of pleasure followed by a sense of well-being and calm. Morphine is an example of an opiate, which was common in World War I and World War II. The fourth and final category are stimulants. Stimulants elevate mood, increase feelings of well-being, and increase energy and alertness. Stimulants can cause the heart to beat faster and will also cause blood pressure and breathing to elevate. Examples are tobacco, caffeine, and cocaine. Key term: alcohol. Alcohol can be defined as a depressant drug that is found in some beverages. Alcohol slows down a person's brain and body. There are usually several reasons why people consume or drink alcohol. First, alcohol can make a person feel relaxed. Second, stress can cause people to drink alcohol. And finally, peer pressure can cause people to drink alcohol because they want to fit in with a certain group, feel older, or just try to avoid their problems. In any case, none of these are healthy reasons to consume alcohol. Can you think of some healthy ways that would reduce someone's stress and get them to relax? If so, please write them down. Key term: tobacco. Tobacco is a plant. Its leaves are dried and then made into cigarettes, cigars, smokeless tobacco, and other products. Tobacco can be smoked, chewed, or inhaled. It contains three major toxins: nicotine, tar, and carbon monoxide. Nicotine is a stimulant drug, and it is very addicting, hence the reason why people continue to use tobacco products. Tar is the gummy substance found in tobacco smoke. Tar is primarily responsible for killing lung cells. Carbon monoxide is a poisonous gas which makes it hard for blood to carry oxygen throughout the body. The short and long-term effects of tobacco. Some of the short-term effects of tobacco are addiction, stains and smells, financial cost, and fires. Long-term effects of tobacco may include heart disease, mouth cancer, lung cancer, and stomach ulcers. Together, these make up the short and long-term effects of tobacco. Key term: inhalants. Inhalants are chemical vapors or fumes that are breathed in through the lungs to produce a high. Examples are markers, whiteout, gasoline, paint, and cleaners. When sniffing inhalants, it can cause the heart to stop beating, which can result in death. People use inhalants because it is cheap to buy and easy to access. Cocaine. Cocaine originates from coca leaves and typically comes in powdered form. Cocaine can be snorted or injected into the body. It has powerful negative effects on the heart, brain, lungs, and kidneys. For example, it can restrict blood vessels in the brain, causing a stroke. Cocaine is also highly addicting because it can elevate mood and increase energy. However, it can equally cause anxiety, restlessness, and paranoia. Key term: marijuana. Marijuana comes from dried leaves, flowers, and stems from the hemp plant cannabis. This plant contains a mind-altering chemical called tetrahydrocannabinol, or THC. Marijuana is typically smoked in the form of a joint or blunt, which looks similar to a rolled cigarette. People use marijuana even though it is illegal because it is fairly cheap and accessible. Short and long-term effects of marijuana. The short-term effects of marijuana are changes in mood, impaired memory or bodily movement, breathing problems, increased heart rate, paranoia, depression, and even suicidal thoughts. Long-term effects of marijuana could be reduced thinking, learning, and memory. Although marijuana does promote harmful effects on the body, it can be used for medical reasons. This, however, requires a doctor's consent and must follow strict state guidelines. Medical marijuana is not legal in all 50 states. In New Jersey, it is legal. However, it is highly regulated by our Department of Health. The power of peer pressure. As you get older, you will face a lot of different situations in your life. Some will be great and welcoming. Some will be okay and just so-so. And some will be difficult and even dangerous. A situation you may face is peer pressure from friends who are using drugs. This is a tough situation and should not be taken lightly because it may result in short and long-term effects for you. In this slide, we are going to talk about the possible effects of these situations, as well as strategies for how to manage them. The short-term effects: loss of friends, confrontation, bullying, and heart-to-heart talks with your parents, guardians, or an adult. However, there are long-term effects. You get to make new friends. You gain experience in dealing with conflicts. You developed increased confidence in how to handle certain situations. And you develop trust among your friends and your parents. Strategies for dealing with peer pressure. The following strategies were developed by Fisher and Urey in 1991, who are authors of the book Getting to Yes: Negotiating Agreement Without Giving In. Although their strategies appear abstract and difficult at first, they will easily be understood and recognized once you think about and apply them to your life. Therefore, I encourage you to identify a previous conflict in your life before moving forward with this presentation. Okay, Let's get started. Strategy 1. Separate the people from the problem. In other words, focus on why there is a disagreement, not the person who is saying it. Strategy 2. Focus on interests, not positions. In other words, focus on why they are interested in getting you to do drugs, rather than what words are being said to you. Strategy 3. Invent options for mutual gain. In other words, you do not have to participate in a negative argument to remove yourself from the situation. Simply acknowledge what they are doing and calmly remove yourself from the situation. This will create a win-win for you without having an argument. Strategy 4. Insist on using an objective criteria. In other words, adhere to your beliefs and family values. Do not compromise or waver over them. Use them as a foundation for making good decisions. Conclusion. Throughout this presentation, we discussed what is a drug and how they are classified. What is alcohol, tobacco, inhalants, cocaine, and marijuana? What are the short and long-term effects of these drugs on our bodies? And how do I respond to peer pressure when faced with these drugs? If you have any questions or concerns, please feel free to email me at eolson@freehold.twelve.nj.us. Thank you for listening. I hope you enjoyed this presentation.